November 6th, 2022, 9 a.m., and we will call the Health Committee to order. Would you please take roll?
Ducat?
Yes.
Geiger?
Here.
Hughes?
Yes.
Awful?
Here. All right, may I have a motion to accept or approve the agenda?
I'll make that motion.
Second.
I will.
All in favor, say aye.
Aye.
Okay, opposed? Motion carried. Has everyone gotten the claims in the email, or right now, I believe you tell them, yeah.
Right now.
Take a look at them. Now, for the newcomers, we don't have anything to do with the health committee claims, but the animal control we do.
When I move it to another location.
That will be discussed in a little bit when the animal control has their report. And for the new ones on the committees today, if you have questions, just please ask. I know it's all foreign to you.
Once you had to wait on me to do what's normal with that, so I'll get that.
All right, may I have a motion to approve the claims? Paul, a second, Steve, okay, would you please call?
Ducat?
Yep.
Geiger?
Yes.
Hughes?
Yes.
Awful?
Yes. Okay, motion carried. Any public here for comments? I see none. All right, we will have a report, excuse me, for animal control from Jill.
Okay, so the total deposit was $7,550 for the month of November. We did have notices being sent out for non-compliance. We will be sending out notices again, more than likely the end of this month. There are 7 cases that are currently open. We have 6 dogs right now that we're waiting to get placed, and 5 of those are being held at the animal control building. One of them is being held by a foster because he is a Chihuahua and he is a little bit mean. So the foster's hoping to work with him a little bit and see if it's just a matter of him being aggressive because he was out on his own for so long, or if he actually is an aggressive dog. So we want to do that before we just make an assumption and have him put to sleep.
Would it be possible that that was the one that was picked up
Took us
Sunday?
2 days to pick him up.
Oh my
He
God.
was backed into a culvert.
Yeah.
Yep, and
We saw
Linda,
him on the way back from church.
yeah, he's a mean little bugger. And, Linda and Jacob took both of them. They were out there twice because she set a trap. Poles weren't long enough to get in there for him, and, so they left him some food and the trap, and then they finally got him. But it took him quite a while, cause he was
Well,
evil.
my wife saw the dog, well, I saw the dog too, and she said, well, somebody must have dropped the thing, you know.
Yeah,
And we did stop at, whoever, the neighbor lady, I can't think of what her name is,
yeah,
and mentioned it to her, and I don't know if she contacted you folks or
yep,
what happened with
yep,
it.
they contacted through ICOM and we got dispatched, and so we have him. He's at, our foster EMG right now, see if we can't calm him down a little bit, so. The officers closed 37 cases in November. There was 7 dogs running loose, 1 nuisance, 1 aggressive dog that was chasing kids around. We had 1 injured Great Dane puppy that got called in over by Buckley by the interstate and ended up passing. We had 11 bite reports that were closed. The officers did 5 kennel inspections. We typically do kennel inspections once a year. Something I started when I took over from Dr. Yusuf, and they're usually done about this time of year. So we have 1 dog-on-dog attack, 5 well checks. We had to take 3 to the emergency vet over in Lowell, Indiana, and we had 2 abandoned pups that have already been placed, so that's good.
Questions for Jill, anyone?
Talking about plans with the animal hospital or animal control building.
Yes.
Have you heard anything from management? I was here yesterday. Are we gonna put that on the agenda for you to get the fencing put up, the new doorway cut in so the dogs can do the dog run? The sign being taken down so it can be, I'm sorry, I'm puking all the signs.
No, you're fine, you're fine. No, I already talked to Chris about covering the sign, or if we can take it down, just save it in case we decide to do something later with it. So Chris is gonna take a look at that. And then I have contacted, a couple of people. Everybody's so busy right now. It looks like it's gonna be after the beginning of the new year in the spring that we'll be able to do something with fences and stuff.
Okay.
So,
Are we still searching for a vet or anything?
I hope so.
Okay, thank you, Jill.
Thank you.
All right, now we'll have a report from our Iroquois County Public Health Department, Dee Schubert.
Good morning. I just have one set of papers for you today. It's the summary report of programs, and every month when I give this out, you know, we fill up our monthly columns, and now this one's full. So this is a year's worth of data. And then on the far left are FY20 and FY21 case numbers, so that you can compare those to the last few years. Amanda, did you get one too? No?
Maybe with our new ones here today, you can explain a little bit about what the health department does.
Sure, I'd be happy to do that. We have numerous programs and services, but basically the health department is broken down into about 4 divisions. We have, of course, administration, and there are 3 of us that work in administration. We have an environmental department. The environmental department does programs, they do the restaurant inspections, the well inspections, the well ceilings. They do all of the sewers, the sewage disposal inspections, so your septic tanks. They do the tobacco compliance program, the radon program, the West Nile virus program. I know I'm forgetting some. They do body art, tattooing inspections, those facilities. They inspect all the pumper trucks that travel in or provide services in Iroquois County. Environmental health, we have a director of environmental health and we have 1 sanitarian. We have an open position for an associate sanitarian right now. Those are like finding a needle in a haystack. I've explained this over the years many times to many people, but those positions are regulated by Illinois Department of Public Health, and the educational requirements on this are so strict. I mean, they can't just have a bachelor's in science. They have to have so many classes in geology, so many in this, so many in this, so many. And really and truly, the only people that qualify for that usually are people that have an over and abundance of extra science classes that they've taken as electives, or have an environmental degree, an environmental science degree. So they're hard to find and they're hard to come by. But we are very fortunate that we have the 2 that we do, and they are handling things very well, and I'm super proud of both of them. So They're doing great. We also have a community health division, which is all of our nurses. Under that division, we do all kinds of programs. We do all the immunization programs, all the communicable disease investigations, and if you've ever seen, I forgot that this was a new group today, so I should have brought you a copy of the Illinois Department of Public Health reportable disease list that shows all the things that are reportable by law in the state of Illinois. It's long and extensive. Even chickenpox is reportable by law now. So it's just very detailed. But those things are reportable by law to your local health department. And it used to be by the hospital or a doctor's office or a clinic that diagnosed those things. But now that has changed several years ago. Those things are reportable by law from the laboratory that tests for that. So once somebody comes up with a positive test, then the laboratory has to notify us. And then we contact the physician's office to do the case investigation and get the details for the individual. And then obviously we contact the individual, and what we do in any given case, we ask them to cooperate and to enforce mitigation efforts to prevent the spread of that within the community. So let's just take a simple one, for example. Let's say somebody has gonorrhea, okay? We would be notified through a system called INEDS from IDPH. I'm just giving you the short version here. It's a lot more complicated than it sounds, but we would then notify that physician, ask if that person had been treated, and ask if that person had been notified whether or not they tested positive. Sometimes the physicians want to let the client know themselves, and sometimes they just want us to call them. So when we call them, we ask them if they've been contacted by their physician, and then we give them their lab results, and then we go over with them whatever treatment is necessary if they have a disease that's treatable. And then we go over mitigation efforts to make sure that their partners are treated, and we do whatever we need to do to prevent the spread of that within the community. Because obviously you know that public health is population health rather than individual health. The community health division also, besides all the immunizations, they do childhood and adult immunizations. We do flu shots. We do, obviously COVID vaccines. We have an Illinois breast and cervical program where women who are unable to afford mammograms and specific treatments can be helped if they don't have that help. We do lead screenings and hemoglobin. We do TB skin testing. If someone has tuberculosis, we provide, by law, we provide DOT, which is direct observation therapy. So in other words, if somebody in Iroquois County were to have, we only have one person on medicine right now. That's really nice. I can just thank God for that. But we go observe them, take their medicine every day, and a lot of times their medicine, they take it for a year in many cases. And we literally have to go to their home and watch them take it. The reason that's so important is because people tend to take the medicine until they feel better, and then they tend to quit taking it. And then what happens is you build a medicinal resistant strain. And then if they spread that out in the community and somebody ends up with a medicinal resistant strain, you've got big problems. Big problems. So it's, that's actually a state mandate now that we do the direct observation therapy on any laboratory confirmed TB cases. Lots of other programs, small ones, not small ones, every program is big. And then we have a senior services division. That's our fourth division. And our senior services division, we mainly have a program called the Community Care Program. And what we do in that program is we link people in Iroquois County who are age 60 and older to services so that they can remain in their home and stay out of a long-term care facility. And we link them to all kinds of different services. We provide meals. We don't provide these things. We make arrangements for these things. But, our community care program, usually we run about 190 people. I think right now we're down to about 172 or 4 clients on that. But those services are really important. And then we have a newer, it's not brand new, because we've had it for over a year now. We have an emergency senior services grant that I wrote for. So anyone ages 60 and older in Iroquois County who needs help with groceries, we can provide groceries for them. We got, a tremendous amount, like $175,000 to help with that. So we literally have so many people to help, and we are continually advertising for case aids, grocery shoppers. But we're backed up right now through the entire month of December and even into January. People that could use help with groceries. So our staff is shopping as fast as they can, and so are the shoppers. But that grant really does help people. And then we also have a workforce retention grant for senior services as well. And I can give you details about that later. But we have a lot of grants that go with each different program, and I didn't go over all those grants by any means, but
The
a lot of
health
services.
department does a lot.
We do a lot, and people don't think about us. They don't realize how much of a difference we make in their lives and how we protect them, and we make sure that they have safe food to eat and safe water to drink.
Right.
And that the community is as free from communicable diseases as possible. We do a lot of this behind the scenes, and we want to do it behind the scenes. We don't often say when we have if we have a medicinal resistant strain of tuberculosis in the county, we don't advertise that. You don't want to make people afraid to go out. What we want is to make it so that it's safe for people to go out. So a lot of our services are done behind the scenes, and people aren't aware of them unless they receive a phone call from us. But we do a lot for people, and if people had any idea, some people are always shocked at the number of services that we provide and the number of people that we serve.
I never knew until I got into this, so.
Yeah, we actually serve each one of you, and many of you don't even know it.
Right.
So that's okay.
Well, thank you for that, I wanted everyone to know.
Just, kind of an overview of us. And while we're talking, since we're having a conversation, before we go over this, this is my last health committee meeting. I think this is around my 100th meeting, I counted them. So right around 100. I think maybe 102. But anyway, after 30 and a half years of public health service, I have decided to retire. The Board of Health has been so supportive of me. They did not in any way, shape, or form ask me to retire. Barb can attest to that. She sits on the Board of Health. In fact, they wanted me to stay, I think. But I'm tired. COVID was hard on everyone. And I'm just going to talk to you a little bit about that for a second. It wasn't easy to be the person in charge of mitigation efforts for an entire county during a pandemic. It was not easy. Every day we were attacked, every day. I got hate mail a lot. Some of it blamed me specifically for the deaths of their family members because they didn't feel that I was doing enough to mitigate the spread of this disease. They didn't feel that I enforced enough things. So I got blamed a lot. And you get big shoulders, you do. And you do the best you can. And then on the other hand, I also got mail that called me Nazis and a communist and said that I was taking away people's freedoms and I was shutting down businesses, which by the way, I didn't shut down any businesses. There were 2 businesses. One business at the very beginning that I asked them not to have a big, huge auction, and then another one was a wedding venue that I asked her, and she was very cooperative. Other than that, thank you. Other than that, but it takes a lot out of a person. You lay your head on your pillow every night and you hope you did the best. People forget, this is my community. I poured 30 years of my life into making sure that my neighbors and my family and my friends were safe. I didn't do that for the money. I did that because I care. I'm a nurse. That's who I am. But I'm tired, and it's time for me to do something else. I think God has another plan for me. I sure hope He does. I trust that He does. I have faith that He does. So, thank you.
We thank you, Dee, for everything that you and your staff have done. It's miraculous what you've done through that whole thing.
Thank you.
And nobody's ever been through one to know how to do it.
It was a
And for
learning
the
experience.
naysayers,
There are always finger pointers. What I appreciated from this health committee, always from this health committee, was that each one of the members, and I know that we've got new ones here and the ones who were here aren't here, but they were so supportive of our health department. They were supportive not only of the health department, but of me professionally and personally as well, and I am very blessed. I feel very blessed. I appreciated that the health committee always gave me the opportunity to speak freely. And they listened to understand and not just respond. I use that term a lot, especially when I speak with Mr. Schurer, because he always listens to understand and not to respond. And that is so appreciated. I truly feel that those who've served on this health committee over the years absolutely wanted the best served on this health committee because they wanted their family and friends to be safe. And they wanted that for their community. And those are people who truly care. And I am very grateful to those who serve, especially those who serve on committees such as yourselves without compensation, because that speaks very highly of your commitment to your neighbors. So I thank you for that. And I also appreciated the people who talked to me rather than just talked about me.
yeah.
That's always very helpful. So on to our summary report of programs. So you see a full year's worth of data here, which is always interesting when you compare to the previous couple of years. So if you look, to the far right, you're gonna see the FY 2022 totals. But on the far left, we put the FY 20 and 21 totals so that you can compare and see where we're at and what we've done, okay? So for those of you who are new on the committee, I'll skim through this giving a little more detail, but you'll see, I think, the same report from the next administrator as well. I'm not actually retiring until the end of February, by the way. I just won't be doing administrative duties after December 30th. So in FY 2022, we did 323 food sanitation inspections. We issued 193 food permits. We did 13 re-inspections. We issued 93 temporary food permits, and those are for things like, the fair and, harvest days and those temporary events where food vendors are setting up. So you can see, if you compare FY 20, there were only 31 and now there are 93. That's because COVID's not restricting people anymore. Boil orders, you can see that we had 24. We had 13 cottage food permits issued. We had 6 plan submittals, 11 openings or reopenings, 13 food complaints that were inspected. And we didn't have any farmers market inspections, but I will give you just a hint that I think it's Wednesday, January 4th, Eric Stacy will be holding he will be the interim administrator starting January 1st. And he will be holding a farmers market public forum, which is now required by law. So a law passed this last fall, a law passed that requires that local health departments invite farmers market vendors to an open forum to allow them to express their opinions on the fees that should be set for farmers market permits.
And that's January what?
I think it's January 4th. I think it's a Wednesday, January 4th. I had to talk to Eric again to make sure he was setting that date. He was working on that yesterday. I'm trying to make decisions for the health department. I'm still the administrator through the end of the month, and I'll be making all those decisions, but I'm trying to allow Eric to have the opportunity to make decisions that he's gonna have to live with beyond that date. I think that's only fair to him. So the law now requires that farmers market vendors have an input on that. State statute says that the Board of Health sets all fees for a local health department, except this law passed last year and now gives, the Board of Health will still set the fee for the farmers market, but it gives farmers market vendors an opportunity by law to express what they think the fee should be. And I don't think that this is necessarily a bad thing. I kind of was involved in this legislation. I wasn't kind of involved in this legislation. I got way knee deep in this legislation because it got a little out of control for a while. Things that were written into the bill were not, I didn't feel were safe for the public. So I asked Tom Bennett to once it left the Senate, to become the House sponsor so that we could have some input into this. And he did that. And he did a wonderful job making it helpful for everyone. Obviously, my job is to make sure people have safe food to eat, but I am a local girl and I believe in these farmers and I want our farmers markets to succeed. And I believe in buying local. And I think we should be doing everything we can to help them. So that was really important to me. So Tom Bennett's the one to thank for that because he really did a good job keeping that under control. He did good. So that is the farmers market stuff. We did 216 water samples in FY22. We had 30 throughout the year that were unsatisfactory that had to be mitigated. We did 51 non-community water samples. The wells, we had 37 new well inspections over the year. 16 of them were non-community well surveys. We issued 39 permits for new wells and 35 for well sealings. And then we did 26 well sealing inspections.
I don't mean to interrupt you, but I don't think we're gonna have time to do the whole page.
I'll tell you what, I'll give you a couple highlights just to explain a few things, and then you guys can look them over and contact me if you have questions. How about that? That'd be
I
great.
don't mean to rush you.
No, it's okay. Under the animal bites, there were 4. We had 2 cats and 2 dogs. One of those cats is listed under the rabies, but the rabies PEP was started in the emergency room on that individual, but it was stopped after the cat survived the 10-day quarantine period. Okay. We had, if you look at the hepatitis cases, I want you to know this was a good month. All those investigations led to not cases. So those hepatitis were not active cases, so that was good. The streptococcal case was very odd. It was found in a lower leg cellulitis, so that's very strange. But it was a positive case. And the patient on the tuberculosis medication is the same patient that we've been treating. It's not a new one. And then if you look over the COVID cases, you can see, because that's one that everybody's always interested in. There were 142 new cases in November, which gave us a yearly FY22 total of 3,961 cases. And I don't believe that's even close to being accurate, because we all know that people are doing home testing and home quarantining, and these are laboratory confirmed testing. So there's so much more COVID out there than that, but people are learning to live with it, and that's what we need to do. So, thank you.
Well, thank you. Any questions for, Steve?
The only question I had, up there under food sanitation, it says cottage food, isn't it? That is food that's prepared, that somebody prepared in their home?
Yeah, well, yes, cottage food, people who have a cottage food license may sell things like,
It's like what you eat.
yeah, exactly. Barb had a cottage food license, didn't you?
Yes, I do.
Yeah, or do you still have one?
No, I don't do it.
Do anyone? But she sold, canned, hot dog sauce, that was fabulous. Yeah, so, those are people that are kind of doing a business out of their home. Yeah, and we support that, and we want that for them, as long as they are doing it safely and not making people sick, we're all about it.
Well, thank you so much,
Thank
Steve,
you.
and for everything again.
Thank
We
you,
appreciate you and we're gonna miss you.
thank you. Thank you, it's been a good 30 and a half years.
Yes. All right.
You have a good day.
You too, dear. Any old business? New business?
Last month, it was after our health meeting, Abra mailed their quarterly report, so I'm just waiting to pass it out
Okay.
to everybody for their review. Not necessarily anything that we have to discuss, they give it out every quarter.
Would you like to explain what ABRA is to our newcomers?
Me?
Or John? Somebody?
John?
What is ABRA?
ABRA is the organization over in Sheldon where they house or help developmentally disabled people. And, they, like a lot of other similar organizations, struggle financially. They don't have enough money to pay their help. Wages are competitive, I guess you might say, so they have a lot of turnover. They have a lot of issues.
Okay.
They get money, some money from the levy from the 377 board that distributes that. So,
Thank you, John. All right, any new business?
I wanna add on to that, at ARPA, we just gave them money for their housing.
Yes, we did. All right, may I have a motion to adjourn this meeting? All in favor, say aye. Aye, or yes.